Hi, this is Dr. Gradwell. What I'm going to show you today is how to do a quadruped Kegel. The important thing about this exercise is this is for the pelvic floor. Again, it's a quadruped Kegel. It's for the pelvic floor. This should only be used when there's an inhibited pelvic floor. This is really not going to be the exercise in the way I'm going to show you for a facilitated floor. So again, to qualify, this is a quadruped Kegel for an inhibited pelvic floor. You would have done prior to this some type of release that your neurokinetic practitioner has figured out by the exam. They've figured it out, and now you've done a release before this, and now you're going to do this quadruped Kegel to activate an inhibited pelvic floor. So how we do this is, normally we're not going to be up on a table either. I'm just doing that so that you get better contrast. What I like to do is get the toes tucked in behind like I've got mine. If your calves are cramping too much, you can lay them flat. I prefer to do it this way. I also prefer to use my fists. You can also do it this way. But what you're going to do is you're going to go into a back position where you're back on your haunches. If you have knee pain, you can put a pillow back here. But once you're in this back position, what you're going to do is you're going to set the Kegel, or we sometimes have to say to guys, hold a pee or poo, but you're going to set that Kegel, and then you're going to breathe in then out, and release the Kegel. We'll have you do 5 in this position. Take your time, get the Kegel, hold it, breathe in, breathe out, release the Kegel. Don't rush through these. Then you're going to go into the up position like this, and you're going to do the same thing. You're going to set the Kegel, breathe in, breathe out, and release the Kegel. I'm going to do it for real right now. Setting the Kegel. Releasing the Kegel. You'll do 5 in this position. Once you can master 5 here and 5 there, you're going to find that one of them is probably harder. And that's actually a good sign. That's a sign that you probably have a problem with your pelvic floor, and we've made the right determination, okay? So then we're going to have you do a moving where you set the Kegel, you breathe in as you come up, out as you go back, and release the Kegel. Take your time, get your head right, set the Kegel again, breathing in as you come up, out as you go back, and release it. What a lot of patients notice that have a weak pelvic floor is they'll lose that Kegel as they go back, and they'll go, oh, I don't know where it went. So take your time, set it, go up, and go back. If you're having problems with it, make sure you report it to your practitioner. Please, one thing you've got to realize, you cannot hold your breath when you do this. If you hold your breath, that is going to only encourage the dysfunction, okay? So you're going to do 5 in the back position, 5 in the up position, and then 5 moving. If you start feeling any discomfort or pain in the pelvic floor, vaginal area, anal pain, things like that, make sure you report that to your practitioner because that could be a sign of a facilitated pelvic floor, at least in one quadrant. We need to know that. This is Dr. Gradwell again. I hope you enjoyed the video.